Welcome to Schoool of Medicines. I hope you all doing great today. As you all know, in the last lecture we discussed hemophilia and its types. In today's lecture I am going to present the following topic. Sign and symptoms of hemophilia. Complications caused by hemophilia. Treatment option for different types of hemophilia. So let's start. Sign and symptoms of hemophilia. Listen carefully, I am gonna to discuss more deeply. Signs and symptoms of hemophilia vary, depending on your level of clotting factors. If your clotting factor level is mildly reduced, you may bleed only after surgery or trauma. If your deficiency is severe, you may experience spontaneous bleeding. There are much numbers of symptoms of hemophilia. Watch on the screen and listen carefully. The common and important sign and symptoms of hemophilia are: the first one. The most common symptom of hemophilia is bleeding, particularly into the joints and muscles. Second one. Blood in the stool. Then. Blood in the urine. Then. Tight joints. Deep bruises. Excessive bleeding. Unusual bleeding after vaccinations. Irritability, in children. It's estimated that 3% of moderate to severe hemophilia patients will experience an intracranial hemorrhage. It can result from a head injury or, rarely, can occur spontaneously. In this case, you should treat the hemorrhage as a medical emergency. Get help immediately. Hope you got all points. Now, come to the next important topic. Complications of hemophilia. These complications can lead to a worse condition, so emergency treatment is necessary. Internal bleeding and the development of inhibitors, or antibodies to clotting factors, are among the potential complications of hemophilia. The main complication of hemophilia are: deep internal bleeding, damage to joint, adverse reaction to clotting factor, infections, development of inhibitors, antibodies to clotting factors, adverse reaction to clotting factor treatment, head injury leading to bleeding in the brain. You're also at an increased risk of developing infections, such as hepatitis, when you receive donor blood. Now in the next topic I will discuss about the treatment for hemophilia. Treatment of hemophilia. Several different types of clotting factors are associated with different varieties of hemophilia. The main treatment for severe hemophilia involves receiving replacement of the specific clotting factor that you need through a tube placed in a vein. Replacement clotting factor can be made from donated blood. Similar products, called recombinant clotting factors, are manufactured in a laboratory and aren't made from human blood. Now listen in detail and be prepared for the topic. So the therapies may include: number 1. Desmopressin. It's a hormone which can stimulate your body to release more clotting factor. It can be injected slowly into a vein or provided as a nasal spray. Desmopressin, DAP registered, is used to help stop bleeding in patients with von Willebrand's disease or mild hemophilia A. This increase in von Willebrand's antigen and factor VIII helps to stop bleeding. The medicine begins to work quickly, with peak effect in 60 minutes. The effect may last 8 to 12 hours or longer. Number 2. Fibrin sealants. Local fibrin glue, FG, appears to be a useful local hemostatic agent for severe hemorrhage in people with hemophilia, PWH, undergoing surgical procedures. These are mostly used in dental surgery. These are applied directly to injury sites to promote healing and clotting. Fibrin sealant, which consists mainly of fibrinogen and thrombin, provides rapid hemostasis as well as tissue sealing and adhesion. Number 3. Clot-preserving medications. These medications help prevent clots from breaking down. Antifibrinolytic drugs promote blood clotting by preventing blood clots from breaking down. Some examples of antifibrinolytic drugs are aprotinin, tranexamic acid, TXA, epsilon aminocaproic acid and aminomethylbenzoic acid. Doctors sometimes give these drugs to patients having surgery to prevent blood loss. Number 4. Physical therapy. The treatment depends on the patient conditions. Usually in hemophilia the joints are highly affected. If the condition becomes worse of the patient, then your doctor may suggest surgery. Number 5. Vaccinations. Although blood products are screened, it's still possible for people who rely on them to contract diseases. If you have hemophilia, consider receiving immunization against hepatitis A and B. Most vaccinations can be given subcutaneously, or under the skin, instead of intramuscularly, or into the muscle, to reduce the risk of a muscle bleed. However, some healthcare providers may prefer to give intramuscular injections using a smaller needle in a larger muscle, like the thigh. Number 6. Antibodies. Here antibodies are used as a medications. Hemlibra is an antibody that binds clotting factors IXA and X. By bringing these two molecules together, it facilitates clotting. Several agents are now available for control of bleeding, but these are often very expensive. The most useful agents include recombinant activated factor 7, prothrombin complex concentrates and porcine factor 8. It is possible to suppress antibody production with immune tolerance, which is successful in approximately 85% of cases, and relapse is rare. So this was our whole class on hemophilia. Hoped you people have liked the video and learned something special about hemophilia. A special request to all my friends and viewers. Kindly subscribe our channel and press the bell icon to get our videos regularly. Thanks for watching. See you soon in the next class. Goodbye.
Motion elements.